For those of you that are just joining us for the first time, I want to welcome you to our Alliance meeting. For those of you that have been here and you're here on a continuation from the last month's Alliance meeting, welcome. We are going to start off today by showing you guys some statistics and some data from the 100 Families Pulaski County initiative. The work that you have all done in Pulaski County in your endeavors to help move families from crisis to career. We have some amazing numbers. Those of you that have been using the Hope Arc system and that have been helping refer clients, referring families, and we've been doing the same here, you're going to see some awesome numbers of families that have been moving from crisis areas. Real quick, before we get started, well, this is going to be the agenda. I'm going to have Paul just to kind of tell you guys briefly who we are, what we do. For those of you that are new, Karen's going to go over some data. Also, there's a poll that's in the chat that we want you guys to go ahead and answer those questions, and we'll go over the results later. And then we're going to get into our panel, our discussion of the housing crisis and how it's affecting children and families in our county. I will introduce our panel after Karen. So Paul, can you start? Yeah. And then Karen, and then we'll get into our Alliance meeting.
Yeah, hey everyone, I'm Paul Chapman. I work for an organization called Restore Hope, and it's good to see you all. Thanks for taking time to be here today. Restore Hope supports community initiatives in what's called a collective impact initiative. There are 5 things that a community has to do if they want to actually change or tackle these very difficult problems that we all work in together. And so we bring some tools and some support, and hopefully one day we'll drag some additional money into the alliances so that we can increase the capacity to serve our collective clients. So that's what we do. We started in Fort Smith a number of years ago, and then we've launched in Crawford County and White County, and just most recently, earlier this year, in Pulaski County. So thanks again for all that you do to make our community better.
All right, Karen.
Yeah. So as Shauna stated, the data is very exciting and getting better and better every month.
That's okay.
I need to.
I told you to close.
I'll mute somebody. So as Paul stated, Restore Hope uses a collective impact model, and one of our major missions is to reduce the rate of incarceration and the need for foster care, and we do that through community-driven approaches, which means that we have to serve families holistically in order to strengthen them and help them to get out of the criminal justice system and be in a place where their families can be together. So we use a model that is contact, connection, and career. And so we have points of contact within jails and courts and DCFS and things, and all of those entities where our clients frequent, homeless shelters, and then we make sure that they're connected to resources and move them towards a living wage career. So 100 Families is a community-led initiative that you are all part of, and so that means that you are 100 families, and we utilize existing community resources and train on our collaborative case management system, Hope Arc. And so thank you, Michelle Spencer's here. She allowed us to give a Hope Arc presentation just yesterday, and so we'll continue to do that to anyone who would like to see how the collaborative case management system works. And of course, our partnerships across the board are with TANF Dollars and Restore Hope and United Way. Pulaski County has enrolled 15 new families this month for 83 active families with 213 children in those families. We just launched in April and we continue to grow every single month. And this is the part that excites me the most, is because Pulaski County, seeing results and positive outcomes does take several months, and every single month the outcomes are better. And so that makes me excited, because that means that the work is working. It's doing exactly what we intend it to do. So as you look at this scale, on the top are the clients at intake. The bright red is crisis, and this is a case management scale. We have crisis, then the gray is at risk, the purple is stabilized, and the dark blue is thriving. And so you will see on the top, for example, transportation had a 27% of the clients that came in at intake were in a transportation crisis. They had no way to get to where they needed to go. And that has gone down. That is now at 10%. So you can see that's what we want to see. We want to see that red crisis area go down, and we want to see the stability, the purple, and the navy to go up. That's the stable and the thriving. Another one I wanted to highlight for you was food. So we went from 34%. That's a lot. That's 1 out of every 3 families that came into to the organization and enrolled in 100 families were in a food crisis. They had no food stamps. They had no income in which to buy food. Now these are parents. These are our target clients, our parents. So 1 in 3 households had no way of buying food, a food crisis, not food insecurity, a food crisis. And that has gone down. So now we're at 18% as of June 30th. So we want to see that go lower and lower and lower. And we do that through partnerships with all of you. The other big area I wanted to point out was housing. So we are continuing to see results, even though this is a crisis, and even though it's hard, and even though we do have a whole lot of clients in that gray area, we are seeing results. And so you'll see there was about a 10% change in the number of those that were safely, affordably housed. So they are able to pay their rent. It's in an affordable place, and it is in good, decent condition. And then even more so, the thriving side has gone up at 12%. So 12% more families were thriving in their housing, which means they're able to pay for their housing without additional supports anymore. So they don't have to, have rental assistance or whatever to do that. And you'll see the crisis has gone down. So where we have the majority of our families right now in housing is this gray area, which is this at risk area, which means they are in kind of temporary, transitional, non-permanent, substandard, about to be evicted. Those kinds of living conditions are where the majority of the families are right now that are being served through this initiative. And that's what this meeting is about today. So I think we could just jump right in. As soon as I show you all the places where our clients come from, most of these clients are custodial, which means they have their children in their home, and there's no DCFS case. So 75% of the families are what we consider preventative. We're trying to keep a child welfare case from having to be opened by addressing recovery and transportation and housing and employment and all of those issues. And another 19% do not have custody of their children, but they do not have a DCFS case. So they are working to get their family back together, but DCFS is not involved. The referral types are, that's a pretty pie chart. I love it when there's a lot of pieces of the pie. And that's because there's so many different referral sources. So you'll see that the sheriff, the ACC office sends 22% of the clients that we have were sent by them. City of Little Rock, 16%, DCFS, 16%, and so forth and so on. And the majority right now are case managed by Restore Hope, and we would love to have more of you case managing and helping in this initiative, enrolling families We can teach you how, and it will help your clients. That's the bottom line, is that your clients will be more successful. And that's what we're all about, is serving families, helping the clients to be successful, helping them move out of crisis and into long-term stability and thriving. So thank you. I'm going to transfer this back over to Shauna.
Thank you so much, Karen. And I want to acknowledge all of our panelists that are here. I think everyone is here. Representative Love has joined us. And I think Ms. Johnson, Ms. Connie Johnson will be with us. She's on our panel. We have Ruthie Hawkins. Am I pronouncing your last name right? Hawkins? Okay. And then we have Michelle Spencer and Mr. Milton Graham. You guys, we're going to bring you, Karen, do you mind bringing them forward to our screen or whatever we do so we can have our panelists on up front? And we're going to get into our discussion for today. We do have a lot of questions that we did not get to last month, but what we'll do, we'll start off by asking a question for you guys. In no particular order, we want you to answer this. What do you believe would be the most effective housing response system? And I would like for us to kind of just dream a little bit and just who should receive vouchers first and how quickly should this occur? Either of my panelists, if you can think about that and give us some feedback on what you think.
Hey there, LaShawna. I think just on my side looking, if I'm going to dream a little bit, I would say we need a one-stop shop with multiple wraparound services within one space and providing a supportive services for the most vulnerable citizens of our community, and that would be the chronically homeless. I see and think that the chronically homeless would need to receive housing vouchers first. You would think that they would need to have those housing vouchers first, since they are homeless and have been homeless for a while. However, I have to look at the overarching reason each of those individuals are homeless, which means taking a look at their situation and their illnesses that may have caused them to be homeless, and getting them into a setting where those things can be looked into in depth, meaning a supportive system in place with a hands-on supportive case management team. And this team consisting of outreach social workers, outreach nurses, case managers, mental health professionals, substance abuse counselors, etc. That list goes on and on. Taking a holistic approach to those that are that is needed, and making sure that those chronically homeless individuals are taking care of their most immediate needs. Having levels as individuals progress through their process. This can be as simple as teaching an adult person how to rebathe themselves all over again, because they have been out in the elements for so long that bathing hasn't been a priority, and only surviving has been their priority. On another side of the spectrum, assisting an individual with a roof over their head in order to help him start a savings account through learning a new trade on site, possibly with horticulture, landscaping, or gardening, moving that individual into a tiny home on site so that he can start feeling a sense of home within an environment that can continue to support him until he's ready to move into that next phase to permanent housing or permanent supportive housing. So you see, I dreamed a little bit. I really see that for Central Arkansas, and I see that we need that here.
That's good. Thank you, Michelle. And anyone jump in.
Yeah, I was going to say, I couldn't agree more with Michelle on the idea of needing great wraparound services for individuals. But I also think that if I were to dream, I think that we need like immediately accessible transitional housing for families and for individuals who are experiencing chronic homelessness that are safe, that are clean, that are low barrier access to, so often getting individuals into any kind of housing, even at our house, even into our shelter, you know, they need an ID or they need a social security
Right.
card or some sort of photo identification. And I was helping I was helping a colleague who's at the Central Arkansas Harm Reduction Coalition, getting one of their outreach workers, someone who's going and delivering Narcan into camps. We were trying to get her an ID. And when you don't have a birth certificate, you don't have a social security card, and you don't have an ID, it is so
Very
hard
right.
to get those
That's
things.
right. Mhm.
So being able to have housing immediately available that is, again, safe and clean and has those amenities, that could be temporary and transitional, in the sense that we know that they are safe if they want to be there for, you know, several weeks while we figure out where they can go and the next step for them to be in that supportive permanent housing. I think that it's, you know, we have been this housing first model for a while, which I think is really important to get people into housing, but what kind of housing are we getting them into? And if we get them into housing, is it affordable for them? Is it safe? Is it, you know, will, you know, the income that they're receiving actually cover the costs associated with living in that home? You know, even if they receive a housing voucher and they get a utility allowance, I know firsthand working with families that does not actually cover your utilities. And then what about your other basic needs that you have? And similarly to what Michelle said, what about those root causes, you know, and how do we address those root causes in systems that are, you know, set up to kind of perpetuate that when a person is living in poverty? It's, you know, anyone can tell you who works with homeless folks regularly, like, it's expensive to be poor. You know, it's expensive to live in poverty. So, and I think for families particularly, I think families and individuals should be separated in a space that is more friendly for families. So that means more supportive, like on-site programming for children and adults. And, you know, one of the things that we see so quickly or so often when we have families enter our shelter is that mom is she's stressed, she's overwhelmed, and she's got these kids with her, and we need to give her a break. You know, we need to be able to have families have those moments of separation so that they can work on, you know, getting, you know, the documents that they need, getting employment, getting healthcare, getting their needs met and their children's needs met. And I think if I were to dream one more way, I think similar to what Michelle said about this idea of developing new skills for livelihood, I think as many opportunities as we could have to give people choices and to feel like they have autonomy in their lives, right? So not just saying, okay, you're in this program now and you have to follow this very prescriptive step 1, step 2, step 3, step 4. Like, how can we give people the opportunity to make choices about how they want to live their lives, and getting them the services that they need.
I'm hearing holistic approaches a lot. Holistic approach.
Hey,
Yeah, that low barrier too.
Yeah,
Low barrier.
yeah, and I would say, Shauna, that I agree with all of those things that have been saying. Since we're dreaming, that dream big, because in our perspective, we've got few other groups that fit into that category. Of course, my experience of dealing with the homeless crisis of children aging out of the foster care system. You know, you got young people who have been in the foster care system, reached the age of majority or 18, and trying to provide for them, especially when they don't really have a family connected with them, to be able to get them transitioned into homes. And we've done this through our independent living programs, and one point in time, even my nonprofit, we operated a transitional home for young men aging out of foster care. That's a challenging, daunting task because of all the many different issues and concerns that they've had to deal with, because they were not, they didn't have obviously because they're aging out of care, then they were not adopted in a forever home, and it connected them to people who will help them to know what it is to have the responsibilities of being able to maintain housing. So that's one group. if we could just dream being able to also keep them safe, but also help them to have gainful employment and education, is all these components of the Children and Family Services programs that we have endeavored over the years and continue to wrestle with. There's another segment that's transitioning, a group of people who are coming out of the prison system, penal system, and to cut down on recidivism. I personally have dealt with this cross section of those individuals. Some of them, unfortunately, have come through the foster care system and then now trying to age out, trying to get out. And whether we want to recognize, we got to recognize also there's an issue of homelessness for those who are coming out, not just because of, you're thinking about those who serve their sentence, but then you got another group who are categorized as registered sex offenders. There's got to be a place that they can come out and be able to be safe in the society, keep them safe, and also society safe. Again, that's a real issue, because if your people are concerned about those individuals keeping the rest of society safe from them, but they're out, and you'd rather have them be able to have housing that's affordable or safe instead of homeless wandering the streets. And so that's another issue. So just dreaming, being able to ensure. And then last but certainly not least is that vulnerable population was mentioned. Those who have young children, adolescent children, and having. I know it's probably going to get into one of the questions you're asked about, which is also dealing with the small children when you don't have enough space for them to adequately have housing for the children, especially in emergency situations.
That's good. Representative Love, would you like to respond? What do you believe would be the most effective housing response system? And who should receive vouchers first, and how quickly should this occur?
I would just echo what everyone else is saying, because I think with Michelle Spencer, what she started off with is she was getting into the coordinated entry piece, and if you're within the coordinated entry system, it would prioritize for those who are in most need. So I would say that not necessarily just dreaming. I'm just hoping that we could get a coordinated entry system established here, so that we could prioritize those families and get them into care, get them directed immediately to what they need, and then we could go forward with the other supportive services that they need. So that would pretty much resolve a lot of the issues. I think we saw it most with the fact that I think there was about 100 or so emergency vouchers that were kind of issued in this area in Pulaski County, and I'm not to say that they're not getting access, but we want them to go to the most vulnerable, and without a coordinated entry system in place, I don't know if they're necessarily going to the most vulnerable. And so
Yeah, and how to identify them.
That would resolve. And it's not to say that they're not going to needy, deserving families, but the hardest to serve among the families that need it are different than deserving families. And so I would say if we were to focus on one thing to actually try to resolve a lot of the issues that we're having, is the coordinated entry piece.
Right. And since you said that too, I do believe this meeting will actually, it's going to have another group of people get together so that we can make some of this crisis or solve some of this. And I will be reaching out to a lot of you just to start a task force, if whatever you call it. We need a group of people, like you said, Representative Love, to actually work together to make this crisis, this housing crisis, just whatever we need to do. We need to get together. I will be reaching out to a lot of you to see what we can do as a team. And if anyone is interested, just email me so that we can get some things started. I know you all are in your own organizations, agencies, entities, or whatever, but if you want to work on a task force with me. Just make sure you contact me. We'll get together and see what necessary steps we need to take to work together to get something done. So let's move on to our next question. Y'all, this is like great conversation, but we have a lot to talk about. So it isn't always best to put just someone in directly from the streets or whatever issues that they're coming from, whether it's prison or off the streets or whatever area or crisis that they're coming from. It's not always best to put them into permanent housing because they may need some additional support. So what makes an applicant ready for permanent housing?
Well,
and again, just jump in.
I would just say first to your first point, well, the thing that you just said before we moved on to this question is I think that that's what our like catch board and like catch coalition is for, to create, to like really buy into that community-led and collaborative effort to address these issues. So I think like really plugging into the systems that already exist to get that buy-in is really important and very valuable.
And then, Ruthie, can you give us some in the chat for those that want to join those initiatives that are already in place? Can you guys put that in there? How do they get if they want to be a part, or is it by invitation only?
No, it's not. Anyone who wants to be in the continuum of care, like our COC, which is for us the Central Arkansas Team Coalition to End Homelessness, which is CATCH. I think I got that right, Michelle. Correct me if I'm wrong.
Central Arkansas
Team
Care for the Homeless.
Yeah, Team Care for the Homeless. I was like, I think I got it right. No, I got it wrong. But I know that our house is a member of it. I know that Michelle Barnes, my our housing director, is really on the catch board, and you know, I'm sure maybe Michelle could tell you a little bit more about that. But as far as your question as to what makes somebody most ready for permanent housing, I think that's really a tough question because there's a lot of different ways in which families need support and individuals need support. My program that I run at our house works just with families, and they have unique needs from individuals. But I know with families, what makes them most ready for permanent housing is having some kind of wraparound support, case management. Like that is so important, to have that education piece of when you're in a home, what are your rights, what are your responsibilities, you know, how do you communicate with your landlord, how do you communicate with your, you know, with utility partner or utilities in general. I think having some kind of income is really important, because oftentimes I think I've seen at our house in the last 7 years, people getting into housing and that cycle of getting back out of housing. And then that's what makes you chronically homeless, is if you don't have some kind of income, whether that's Social Security income or employment income, how are you supposed to maintain in housing in that way? So that to me is a really important factor in that. In a lot of rapid rehousing models, they're able to pay for 3 to 6 months of rental assistance, or even in a voucher system where you only have to pay 35% of your income towards rent. Still having that backing somehow of being able to maintain that housing is really important. But that's why I think there's this opportunity for transitional housing to get people prepared for that, get people ready for that. Because things like getting employment or receiving benefits that you're, eligible for takes time in our systems that, exist right now. And everything from getting the right documentation is just really challenging. And can take time. So getting people set up in a place where they can be safe while they're waiting to get into permanent housing is really important. So I think that employment piece and those wraparound services that are going to be longer term than just, okay, we've got you into your place, good luck. Important.
Continuum of care. Anyone else?
Yes, I would add, a person being ready for permanent housing is a very delicate process for me. The initial intake of each individual is key. and assessing the person for vulnerabilities that may not allow him or her to really be ready to go into permanent housing immediately. That's why I spoke about the supportive services. They are so key to the process in preparing an individual to one day progress over into permanent housing. It may start out being permanent supportive housing to start out with, which will allow them to have a case manager to periodically help them get to the meetings and appointments that they may need to help them be productive citizens, and just get them reacclimated to what that means to be housed. And my focus is really on chronically homeless. I mean, I just see that we are seeing a very large amount of individuals on our corners, in our cubby holes, and they are living there daily, living there often. This is their home. So you're going to hear me speak a lot about the chronically homeless, because I really feel like that is our most vulnerable population that we need to get immediate attention to. That's all I have.
All right. Thank you, Michelle.
Yeah, I would say I agree with everything that's been said, and I can't emphasize enough the need for the wraparound service and support, but also the education, which I know goes along with the wraparound services and support. But I believe and know that knowledge is power, and many times when people do not know anything different, or not been and anything different, or they have a long period of time of chronic homelessness, and the mindset, it's in the mind. And so when you change what you know, then you can change what you're able to do. And what people see when they actually see something, see it modeled, and but also, I've seen in families that we've been in crisis, and our facilitators who do the team decision making, you see that many people being able to trust people to walk alongside them. People have to be willing to know that you're really empowering them, and in order to also encourage them so that they can take advantages of the services, supports, wraparound services, because many times that sometimes you got generational situations that are going on, not only the family you're dealing with, but that's what they've seen, that's what they've grown up in. And as was stated just a little bit earlier, and Spencer was saying, you got people that have gotten used to being where they are and living in the cubby holes and homeless situations around the city, the network of cities under bridges and places, and that's just what they've gotten used to being and doing. So you have to change the mindset. That's so important.
Thank you, Mr. Graham. Representative Love.
Well, I mean, there's not much that I can add to that. So start choosing me first to answer.
You
No,
don't have to do the man first.
no, but seriously though, I would on another note, I would say that we need to change our systems though, because as people mentioned, housing people, that's a delicate issue. And you can provide the services, but it's going to be some intense hand holding, and sometimes agencies they're not equipped to do it. And so changing our system so that we can meet the very immediate needs of people. I mean, the case management is just going to be so important. And so, a lot of agencies, and I would say even Pulaski County, include my own, a lot of agencies, we're in the housing arena. However, the intense case management, we don't specialize in that. We don't specialize. We're moving, since we do have the shelter plus care permanent supportive housing. We have added counselors, but intense case management is necessary. Street outreach is necessary if we're going to solve this issue, and it can't be kind of like something that you really add to your program. You can to make your program better and more efficient, but really we need agencies, and this is why I say, and systems changing. We need agencies that really specialize in doing this, and we need to coordinate better because, you know, I can provide someone with a homeless individual with a voucher, and we have to have it executed within 14 days, according to, you know, the policy of what ESG has outlined. Well, if they don't have anybody, you know, I'll give you a story. This is a perfect story, right? So there was a friend of mine, which was a neighbor. He had a guy that did odds and ends at his house, and but he was homeless, right? And so I said, you know, man, if he really wants to get some help, you know, send him down to my agency. We'll give him we will give him a voucher. We can have him, you know, we can, you know, we can put him up in a hotel. I think we put him up in a hotel that evening so he wouldn't be sleeping outside. We're, you know, and then we can give him a voucher, man. He can go and get him a house. This is that and other, right? Mm-hmm. Well, my agency is not built for just intensive, just case management like that. Well, here's what happened. We set an appointment because, you know, we're kind of an appointment only agency. We set an appointment. Well, he didn't show up. Wow. Okay. Well, guess what happened? This gentleman hadn't had a peaceful night's sleep in years. So when he got to the hotel, guess what he did?
Slept.
He slept. Because
he enjoyed that hotel.
Yeah. He was undisturbed. He slept.
Right.
And you know what? But on you know, in a system, the system doesn't understand. You have an appointment time, you need to make your appointment. If you don't make your appointment, you lose your appointment. You know, I mean, those are the kind of systems changes that I'm talking about, to where we really truly understand what we're dealing with, what we're grappling with. Because I mean, if I wouldn't have kind of followed up and said, hey, you know, I went to my friend and said, hey man, you know, he didn't show up. He didn't. In these kind of experiences, you know, on a regular basis, you wouldn't have. But it was just me taking that extra time to try to understand, like, all right, what happened? So then when he did come to the agency, he didn't utilize the voucher. Well, guess what? It takes time to get out there, and you know, he doesn't have income. He has the job, the kind of odds and ends jobs and different things like that. Well, you know, now landlords are like, hey, you know, we're not interested in housing people that, you know, that really don't have an income, because then what are we going to do with them if your program ever goes away and different things like that? I mean, like, we really have to have some systems changes in a system working together to really help individuals that are in need, because these situations are becoming more volatile and they're really delicate. So, I mean, we really need a real. We have to really look at our systems, because we need a systems change, and we need it immediately if we're going to help individuals that are truly homeless. So,
I agree. That is, and I totally agree. That's kind of like a soapbox, and I'm talking to Paul about just how the system works and not really understanding the needs of a person. So yeah, we can get into a whole nother conversation about that.
You know, I guess as commentary, you know, we all work in our silos in the system, which is how, you know, our silos were designed. And what I think is needed, and hopefully before I breathe my last, I'll see it happen. But is, you know, it's like we're all hedgehogs. We got our head down. We understand our deal. There's a bunch of rules and regs, and those things are good. They were meant to do well, but there need to be some foxes that can see the whole picture,
right,
and redesign housing to work with the employment programs that can work with. Because how often do we all go, well, you know, he's 28 years old. Now, I got all kinds of 18 to 24-year-old money that could have paid for some vocation, but right, so I can help them right now. I ain't got no 28-year-old money right now. And that's just the way that's just the way it comes to us. is, it's piecemealed. And I'll tell you one other thing that I've just thought as I hear all you smart people talk, community to community, when I go around, we really do need that fully thought out continuum of care in the way that human services work together in our communities, because it's as if, let's say, Mrs. Chapman goes and buys a piece of land and we get an architect and I've got a plan and all y'all are the best subs. Milton, he's got a great roofing company, right? Rep Love, his tile company, off the chain good, right? And so I get all your subs up and I go, I got $500,000. I want this house built. It's over at this address. Now y'all go build it, please. And the roofer shows up the very next day and there's not even footings poured. That is the way that folks typically encounter us in the human services. It just doesn't work together. And so it takes us really providing a lot of, time like right now, just working through trying to understand, what you can do and what you're having trouble with, and then how do we coordinate the services, because it's hard enough for us to navigate it, and it's dang near impossible when someone's kind of at their lowest point and they're in crisis. They just can't get it done, and that's not right.
I agree. We got to work together, guys. So, now to move on, for sake of time, let's get into this. What about the availability of housing units, which has been a problem? So in Pulaski County, what are the gaps in the availability of housing units across the spectrum? Is it family units with 3 or more bedrooms? I think Michelle and Mr. Graham, y'all touched on that. Is it units for elderly? Is it decent, safe housing? Is it felon-friendly options? What do each of you see as the biggest gap in the housing units availability here? Representative Love, can you go first?
It's all of the above. As a housing agency, and I'm gonna tell you, after this pandemic, it's gonna even get tighter. Mm-hmm. We have because we're running an emergency rental assistance program, and I cannot stress enough. And I guess this is because I'm just kind of in the throes of it now. I cannot stress enough how this housing market is gonna it's gonna tighten, because of the fact that landlords are now saying, hey, if you don't have income right now, and it's two and a half to 3 times the income is 2.5 to 3 times your salary. Your rent. We're getting you out. They're not even taking the money. They're saying, I don't care if there are 9 months and you're going to give me 12 months. That's it. We don't want them in here because they can't guarantee that they're going to continue to pay. And so you're going to see the market even tighten. As a housing agency, I would tell you, the larger the bedroom sizes are, the more it's harder to come by. We call how hard to house families. Anybody, I think, with 4 or more people in their house. And it's hard to come by 4 or 5 bedroom homes. It's just, homes are apartments. It's hard to come by those. But I would say right now, you're going to see a big shift in the market, because landlords are really, after this pandemic, they are not there. You still have some that are really, like they're willing to work with you, but we have some very large landlords that are like, hey, I just want people out, and they're beginning to work less and less with us. And so it's going to be more difficult to even house anybody. As far as, it doesn't matter the bedroom size or not, it's just going to be more difficult. And so I say that, if we don't get into the business of actually probably creating affordable, safe housing, whether it's, apartment complexes or houses, we're gonna be in a world of trouble, because people are really beginning to turn away our vouchers, whether they be Section 8 vouchers, whether they be VASH vouchers. They're starting to turn away our assistance.
Yeah, I'm glad you brought that up, Representative Love, because I feel the same way. Because getting families, we work with families. Our largest family right now is a family of 12.
Oh,
Getting,
wow.
getting them into housing that is safe for them is really challenging. And even when you have a voucher, and that's going to be subsidized rent, if you're a single parent, you have 3 to 4 kids, let alone 12, or 11 in that case, you have, 3 to 4 kids, you work $11 an hour. There's no way your income is going to be 2 to 2.5 times the rent to even qualify for a place, even if you get subsidized housing. Like, that is a real big challenge. So then we push because families don't have an option into apartments or houses that are substandard at best, that you're in a place where, your plumbing is backed up. All of a sudden you can't use your one bathroom in the place and you want to leave. And then that's going to go on your credit. And you're in this cycle of being in and out of really terrible housing. Even if it's like what's affordable doesn't mean it's adequate or safe or sustainable for a family. And I'm sure that goes for, individuals as well as families, just finding places that will accept tenants who have poor credit or who have a poor rental history or no rental history is just really challenging. Because we've had families, get that voucher and it's like, yes, this is the greatest thing that's ever happened for this family.
You can't find a house. Yeah, you got a voucher.
Because even if you have a large voucher, if you don't have that income to match or to qualify for a place that's worth living in. And then there are places that, I think we've seen a lot of community violence in Little Rock and in Pulaski County this last year. And not like that is necessarily new, but I definitely feel like it's definitely personally impacted me and personally impacted my team and the families that we work with. So finding places that families genuinely feel like are safe, where they feel like they can have their families and their kids outside is hard. And it's not something, to take lightly at all, to be able to find places.
You're right.
Are y'all aware of any upcoming, is anyone developing any neighborhoods or additional beds that y'all are aware of right now?
Not that I'm aware of.
Things are in the works, but nothing accomplished yet, no. But
now,
if I could add,
I will say this, Paul. I've talked to River City Ministries, who's talking about some transitional, but nothing besides that, nothing besides like permanent, like apartments or homes. So those, I mean, these are things that we really need to get after. I mean, and hopefully, our housing agencies can come together and try to resolve this issue.
Yeah.
What would so if y'all were kind of thinking about neighborhood design or multifamily apartments as you look around the rest of the country, I know y'all are excited about some and wish that it was here. What would those projects or developments be? Do you have any that you just wish that the same kind of design was done here, or someone's doing something really innovative?
I would say if we looked at San Antonio has a really great model. And the reason why I say San Antonio is because their housing is also linked with their crisis stabilization units and different things like that. And so it's kind of, and then it's linked into their training with their police officers for their crisis intervention training. I mean, so if we were to look at a model that I've personally seen, I mean, I bet you there's some more out there, but I know that San Antonio does a great job because they have their they have their homelessness, the crisis intervention, crisis stabilization unit, housing, all there within like, it's just
The
right
whole
there.
community. Yeah.
Easy to get services.
Say that again.
It's close together, so services are easy to access.
Yes, definitely.
Yeah.
Michelle,
And
you wanted to add, oh, go ahead.
No.
Well, no, I know Michelle wanted to add to the last question, but Paul went into that segue of exactly what our next question was coming up is if you could build any type of housing, what would it be? And if you know of anything, what could we, what kind of model would that look like? So, Michelle, did you want to add to that last question and then comment on what that housing or what type of housing would you be able to think about building right now? How would that look? And then Representative
Yes,
Love, if you want to continue.
Yes, LaShawn, I would say, actually, Fred and Ruthie touched on some interesting topics for the affordable housing, but I'm going to go on that other side and add a word in there, quality affordable housing.
Yeah.
And
Yes.
I add that word because it seems to not be a standard any longer for a lot of our landlords that I'm hearing, and Fred touched on a little bit of that, but I
Yeah.
get so many calls from citizens that due to in Arkansas being the only state in the union that don't have any tenant rights as far as anything outside of that lease agreement, meaning the landlord has more rights than the tenant. And I see that being one of those system changes on the actual state level to get some of that changed around, because we shouldn't be the only state in the union that has those less of rights for the tenant. And if there's an issue, that landlord can just say, like Fred said, I don't want to have this tenant here anymore. I'm not going to even accept the payment. I want them out of here. And that's a concern, because I get these calls on my end with folks trying to issue. I tell them to issue a moratorium declaration to their landlord, and their landlord doesn't even honor it, and they end up getting evicted. And so that part right there, this pandemic has crippled a lot of people. People have been evicted, but that issue is something that we have to really touch on as well and get some of these laws changed, especially getting more rights for the tenants to be able to have some quality, affordable care, some quality, affordable housing. That way they can get all the other needs met that they're needing.
Yeah.
As far as that other question, the one-stop shop, there are so many different cities across the nation that really have those systems all worked out. I would say Fort Worth, San Antonio is another one. Texas seems to have a lot of things going as far as their areas where they have that one-stop shop already in place, where everything's in-house, and all of those silos that Paul mentioned are really not existing because everyone's working in unison together to be able to assist those individuals. So you can Google it and find all sorts of organizations that are already existing. And we are probably, for the city to be the capital, we should have one of those places in place to be able to serve the homeless. I don't see why we're not on that level. And that's something that needs to change ASAP. It's past due for us.
I sat on the board of a transitional house for 5 years, and I would go to bed at night wondering if I was going to get a call in the middle of the night because one of our residents had stole our car and run it through the plate window of the liquor store down the street and gone on a tear. That was my fear. He's going to hurt somebody. And so when I got off the board of that organization, I thought, I'm not getting involved in real estate any longer. But I had a long talk with Karen this morning where I'm like, golly, we have just got to bring more beds online. So anyway, I'm not I'm not committing to y'all that I'm going to do that. I'm just thinking we
We'll
have,
have another conversation after this.
let's
and
go.
I'll get back with y'all.
I'm going to go find some other sucker to do it. But we've got to find some folks to bring some more beds online that are energy efficient and they're worth living in, and that it's built with a livability feel to it where the residents feel like they've got some ownership and all those things that we know need to happen.
Okay, can I add something? Because I'm gonna have to jump off real quick because I have a 2:00 Zoom, another Zoom meeting. But here's one thing I do want to say, and yes, we do need to lobby the legislature for the tenants' rights and standard of habitability. HQS is what we use. But here's one thing I would like to say besides doing that, because that's one thing that we need to do. But also, we need to actually hold our programs and people that administer our programs to a higher standard as well. Because if we're placing people in substandard living conditions, if you're taking my voucher and I have you in a substandard housing, then I'm just feeding into that system. So I'm not really charging the landlord to be better because he's going to get my money anyway. And so, therefore, we need to really examine the programs that we have that we're administering. And that is from top to bottom, because I've been in places where I would tell you this, I've taken over some programs and we had to move every single tenant because the program prior to ours just leased them up in substandard housing. So, I mean, until we begin to look at that as well, because we can't put it all on the landlords, because guess what? If that landlord's getting $800 from me, you best to believe that that's meeting HQS standards, and I try to squeeze every bit of HQS standards that I can out of that, because he's going to have my tenant living in a place where I would live. So with that being said, I appreciate what you all are doing. I look forward to working with you, and I have to jump off right now.
Thank you, Representative.
Thank you.
I'll be in touch. Thank you.
I have results. Do you want to see those? Okay.
I do want to see those. And real quick, while you show those results, I just want to get to at least one of the questions that we didn't get to last month. And that is, how can churches get involved with the housing solutions? And on the continuum of care level, what is needed from an administrative point of view in order to better serve those in need? So y'all can think about that. You can, let's go with the poll now. What do we have, Karen? What's some of the results?
Okay, so this is just a real quick short poll, and not very many people did participate, but we still have really great feedback. Out of a, can you hear me? Yeah. Out of a 0 to 100 scale, how big of the problem is in Pulaski County? That average number was 91. So basically a 9 out of a 10. Everyone thinks that it is a huge issue in Pulaski County. The needs in Pulaski County for very low income families, from highest need to lowest need, and you can see the scores here. And the top one was emergency shelter for families. The second highest was a tie between housing vouchers for low income families to lower rent cost, and transitional housing for families. And then it went down to housing vouchers, availability of a housing in affordable price ranges. So those were the top needs shown from you all that just participated. If you could build only one type of affordable housing at a time, which would you build first? A tie between more family units that are affordably priced, and units for rent with less barriers on past, coupled with supportive services. So it's very clear that that's a huge issue. And then also transitional housing for families. I almost feel like you could, with just one type of housing, fulfill all three of those needs. So you could make it a transitional 2-year kind of program. You could make it have less barriers, have supportive services, and be affordably priced rent wise. So that's pretty interesting to me. What do families do when they can't find emergency or affordable housing in the Little Rock area? And I just wanted to kind of have an open-ended question here, because I just often wonder, because I know that y'all have such a crisis there, and I know, you know, the families that we run into, but what is the outcome of what happens to the people that we're not able to help?
Yes.
And when we think about that, I mean, that's what gives us all, you know, keeps us up at night, gives us chill bumps, makes us want to do more. And they suffer. They reach out for help. They get trapped in hotels. I can't believe how many people stay in hotels when it's so unaffordable. It's not affordable at all. And yeah, Ruthie's like, good grief. Yes.
It's not affordable, but like, what is the alternative?
Yeah.
Yeah.
Yeah. It's like the options.
Yeah.
Families might become homeless if they can't find suitable housing. Many are forced to sleep in cars or family members' houses. We know that this is not good situations for children or parents, but, you know, particularly, you know, having to just rely upon whoever will give you a couch for that night is really not a good situation for our families to have to be facing. How long is the family going to allow them to stay there? Many families members are now evicting their family from their homes. And then the next person said, depends. Some stay with friends and family. Some stay in hospitals for extended stays, some in cars, some on streets, and some of them even offend in order to have somewhere to sleep. They sadly become homeless. There's not enough housing in Central Arkansas. They resort to family friends, shelters, unfortunately become homeless, and they live on the streets or in possibly dangerous situations. So those are the realities for who we're trying to help.
Thank you, Karen. Great input. I thank you guys too. And if you know of any way churches can help, what do you guys think churches can do to help this crisis?
One of the things churches we can learn to work together collaboratively, and it's a problem, I hate to say, among the church. I've experienced and see whenever the church has been effective, in my experience, is when we've been able to come together as a body of Christ and not just play, you know, in silo situations. And we've had churches that have been effective in certain areas. We have certain things that we do in our ministry at Bethesda, MBCLR, but I seek out us working together, because I always say that none of us is as strong as all of us put together. And we can, much like the 100 families of the church community, can learn that, find out what you specialize in, find out what gifts and talents are in your church, and then see what you don't have and what the other churches and pastors can do. So that's what I see.
I ditto what Milton is saying, actually, just making sure that the quality affordable housing is touched on within the churches. They can reach out to their members. And there are a lot of property owners, homeowners that rent out, and just letting them know that there is a collaboration needed to raise our housing stock, and just having them, because some of these congregations are very large and have resources available, food pantries and et cetera, to help assist, those who might be getting into new homes. It's just all sorts of resources available through churches and a collaboration with them, and just to cultivate relationships within their membership to be able to help assist with those collaborations out there.
Mr. Graham, do you know of any churches that have properties that they rent out to people or homeless, or do you know of any churches like that in Little Rock? I'm in Garland County, so I'm just,
there are specifically that I'm aware of. I'm not going to say that there are any, but I think just coming together, I know that as far as properties for family units. You know, I know there's a few who have I think Rock Creek, not a family unit, but it was an emergency shelter that was assisting and helping for family shelters for a period of time. I think they still have it, but this is something that, as was Spencer was saying, that you know, you got some large congregations, a lot of resources, and a lot of people with knowledge. If we come together and say, hey, you know, let's make this happen, you know, because I think that there's a lot of things that we kind of turn back into the government agencies, which is fine, but it's really the work of the church, and we have resources, we have people, and I think, you know, that's what has been helpful about the call when it came to training foster and adoptive families, that it's, hey, let's look at the church, because this is the mission of the church. Really, we're talking about, when you're talking about homelessness, people who don't have a place, and train this really the, you know, and I push that quite often when it comes to these issues, that it is the work of the church. So I think that you know, this is something we long past time for us to come together as congregations, as churches across the denominational line. This is not a Baptist thing. This is not a Kojic thing. This is not a Pentecostal thing. This is a God thing, and we've got to solve this. So you know, that's my piece on it.
I have two things to add. One, there's an organization called Family Promise of Pulaski County that used to try really hard to get folks connected, congregations connected, to provide housing for families and individuals on a rotation basis. And one of the last times I talked to someone over there, it was just really hard to do, really hard to find churches like had space, who had the willingness or the long-term commitment. Some folks would put families up in hotels for a week at a time. And I think being able to provide that emergency housing piece, and then partner with places who, or with agencies like my own program, you know, we've gotten calls from churches who are like, we've been helping this family, and now we need y'all to take them off our hands, essentially, because we don't know what else to do with them, because we're not there overseas, right? Which is fair. But housing folks and being able to provide that emergency shelter when available, I think is really huge. Being able to have a network of you know, when you have folks who are in your congregation, maybe who have rental properties, who have extra spare bedrooms, like who have places that are willing to open up their homes. And then we have a great partnership. There's a great organization, one called Healing Waters, and another called Settled Souls. And Settled Souls is a congregation mission effort that they collect furniture, and then they furnish new apartments. They work through Jericho Way, and they also work through us to give us furniture for families moving into their own places. And I think they're just an organization who was like, you know, I think it came from mission driven, being like, well, this is something we know we could do and we will do. And, you know, I think working together throughout congregations to, like Mr. Graham said, like really working together to create this network of like, okay, we can house, like we have storage for mattresses and furniture. Like, do you have that? Okay, we'll have it here. Do you have a family who needs it? Okay, we'll get, we'll, you know, get some volunteers from our congregation to move into an apartment for a person or a family who's in homelessness. Just like ways that you could come together that aren't just housing people, but, you know, providing that assistance.
Right.
And listen, make no mistake about this. This is hard work. You know, that's one of the things. This is not easy work, as Paul knows well. When we for about 2.5 years, we operated the transitional home for the young men aging out of foster care, and these young men were grown, and it's hard work. And unfortunately, we don't have a house anymore that was suffered a loss through arson. But you got to have people that collaboratively come together for the supervision, for the training. We're talking about that intensive case management piece, wraparound services, because when you start putting people in housing, and so the church, you know, it has to be a mission driven, that from the leadership of the church, the pastors, the pastors in the church, and those who will really work and even train the congregations how to work with those individuals that are going to be in those kind of housing and situations at the church. And so you really have to train the congregation to know how to work that. So, and sometimes that's what's lacking even if I would say even in larger congregations, you got to have people there that's in their mission. That's what they're wired to do.
Right. Yeah. So as we end, I just want you guys to answer this last question, and we will end our session for today. But so when we talk about the continuum of care and the level of continuum of care, what is needed from an administrative point of view in order to better serve those in need?
I would say we've already discussed it. Pretty much an all-inclusive platform in order to assist the homeless and those at risk of homeless. We all have to come together and really stop talking about it and being about it. And I'm just been here for 6 years in my role, and I've seen a lot of these types of meetings, but I'm looking for the fruit from these meetings to start happening.
Yep.
So that's where I am.
All right, Ruthie, to wrap it up, what do you say?
I think I feel like I can tell that you want me to be, or you want us to use this Hope Arc system like really well, or that's like the push here. And I think that's a great idea. I think having people on one platform is great in theory, and I'm curious to see how it would be in practice with, other obligations that organizations have to reporting and to HMIS and to HUD and to our other grantees, and how that could all work together. But I think, to me, having relationships with other organizations, being able to, know who to call to at that other place. And I think, I think Fred said this earlier, but this like willingness to really provide services to individuals and families. I get calls all the time from folks who are like, I called so-and-so and they said they could help me. And then they referred me to this other person. They said, no, we don't do that anymore. So having those relationships and, being open to, sharing information is just huge.
Oh, thank you. You're right. Mr. Graham.
Well, I would say ditto to what's being said. I think Spencer said it well. Be about it. We've been talking about it, and the Hope Arc is a great platform. Coming together and to make it happen. And, it may not be all of what we envisioned in the beginning, but nothing beats starting and getting moving forward. And so, like I said, I can't really add any more to that other than what's been said.
Well, thank you. You guys were great. You're amazing. Had great information, great discussion. Paul, you want to add anything?
I'd just say, we've in Fort Smith, we launched about 3 years ago, maybe 2.5 years ago. We launched 100 families there, and they are seeing really the fruit. That community was it was so tough there. They had the highest conviction to incarceration ratio. 1 in 34 kids in 2017 was in foster care in Sebastian County. It was really tough. And so they're doing things different now. And if a mom, I think we're on our 3rd year of above 80% reunification rates when the community works together, and mom will work with that alliance there. And so that's what we're hoping to see here in 2 years. We've been at it for half a year here. In 2 years, we're hoping that's true here too.
Yeah.
And we got some more beds.
That's what we need. We need more beds.
Quality beds.
And like you guys have stated, we have to stop talking about it and be about it. We have to do, the work or whatever it takes. We have to change mindset. We have to change legislation, laws, all that. So you guys will be hearing more from me, and we will definitely, hopefully we'll see you guys next month at the next Alliance meeting. But thank you for all the work that you do. Thank you for being a part of this panel, and we will be in touch. Thanks everyone for
See y'all.
joining us. Bye.